All right, so you're welcome. I'm here again with this time something very interesting. I'm going to be reviewing your exams, actually, the essay question of some medical students who just did their final exams. The purpose of these lectures is to make you better. It might be quite extensive, but I encourage you to wait, stay the distance, listen attentively. This is not something to listen to when you're just, playing around with friends. You should pay attention to every detail because they will really help you. There are a lot of resources on this page, and I encourage you to make the best use of those resources. It's not just for the sake of making videos, they are to help you. Sometimes we have interaction with you in groups. And if I have an interaction with someone in a particular group, those in a different group may not get to hear what I've said. So these videos are one of the ways to make sure that there's not so much of discrepancies between the information a group has and that another group has. Now, I want to start by saying that to some extent, I was disappointed with most of the candidates who answered this question. And the reason is simple. If you look at this series, this medical student series, you see a series on how to answer essay questions. It's clear, but it's obvious that many people did not listen to it, and so they did not know how to approach the essay questions. How can somebody tell you and put the information freely there, and yet people don't take note of the information? So what I'm going to do is that I'm going to read out the question, the essay question, and then I'm going to go through the marking scheme. You see? And then I'm going to go take you through some of the things that candidates actually wrote, and the ways they approached the question and the kinds of scores they had, and then I'll add some extra tips to you. So it's going to be a bit long. However, you need to pay attention. All right, so the question: a 38-year-old obese woman presented to the emergency department with a history of right upper abdominal pain, which has been present for several months. In the past 3 days, the pain has become more severe and is associated with fever and vomiting. Clearly outline your management of the patient. 30 marks. This is part of an essay exam that was lasting 3 hours. And one of the tips, I always tell you, you must time yourself when you're doing an essay exam. So you don't write one question for 1 hour and then you start struggling to keep up with writing other questions. Divide your time equally. So this question should be answered within 30 minutes, typically. Right? So even if you say you want to add some more time and you answer it for 40 minutes, I mean, that would be fair enough. But never lose sight of the time. All right, so next, what are you expected to write here? You're supposed to introduce. And the introduction is just in 2 lines, just to let the examiner know your thought process. So a typical introduction is: this patient or this clinical scenario is pointing to a gallstone pathology based on the risk factors and the complaints. So that's simple, very brief introduction. And that is because the question has stated clearly risk factors for gallstone disease and has also listed some complaints that are related to gallstone disease. If you do that, you get your full marks. Then Like I said, management questions, beginning to the end. History, you must tell us that you're going to complete the biodata of the patient. You don't have to be saying, I will ask, which local government are you from? I will ask, are you married with children? With the biodata, just tell us you are going to find out the name, the occupation, and other elements of the biodata of the patient. That way, we already know this candidate knows what they are doing. You don't have to start writing NASOMAT and start saying tribe is the tribe. I want to ask whether the patient is Yoruba or Igbo or Hausa. What's that? We know that you are going to ask in real life, but this is an exam. We only need to know that you are aware that you're going to ask this question. So you will not start giving options. I want to know, you don't say, I want to know whether the patient is Christian or Muslim. You are already wasting your time. Right? After the biodata, then you will collect the symptoms that have been given to you. So abdominal pain, you have to collect it fully. All right? So, and when you are clicking abdominal pain in a typical essay question, you say, because you know this is gallstone disease, you will write your essay in line with gallstone disease. You will not start saying, I want to know whether the pain is in the right lower abdomen. When they have told you the pain is in the right upper abdomen, why are you repeating it? You click abdomen. So you want to know if the pain, how severe it is. You want to know the onset. You want to know whether it's constant or it's colicky. You want to, and you are going to be inserting what you expect it to be. Pain of gallbladder pathologies is constant, right? So you have to write it like that. You have to talk about relationship with fatty meals. And you have to talk about the aggravating and relieving factors. Very important. So those are the things you are going to talk about for pain. You will click vomiting because they mentioned vomiting as one of the symptoms. You talk about fever. Was it high-grade fever with chills? And then you will now go through other symptoms of gastrointestinal problems. That's where yellowness of eyes and all that comes in. However, your patient did not have yellowness of the eyes. If your patient did not have yellowness of the eyes, why would you use a whole page to be clicking yellowness of the eyes? Yellowness of the eyes is not one of the complaints. So you don't click it. You don't start saying you want to find out about history of use of sharps. I want the history of multiple sexual partners. You don't start going into that because the patient does not have yellowness of the eyes. So those are the mistakes that you people make. So you have a lot of information, but you are not using it appropriately. You then go into a review of systems. And I've told you, when you are doing a review of systems, you say you want to do a review of system. You want to see if the patient has cough or chest pain. You don't write all the features of respiratory problems, dyspnea, autopnea, parasite. No, you don't do that. You just put 2 symptoms that are related to the respiratory system, and you go on. Cardiovascular, 2, because the patient was not said to have any of that, and you don't expect this patient to have any of that. So all we need is for us to know that you are thinking in line. You already know that when you see a patient with a pathology in one system, you don't ignore every other system. But for the purpose of the exam, you don't start listing everything. All right. So you go to the gynecological history here. Very important. And when you are talking about gynecological history, you talk about how many children, oral contraceptive pills, last menstrual period, and all that. That's all. You don't have to start saying we want to know whether she lives with the husband. How does that one have anything to do with this question? Past medical history. You share considered in with something. So you go to the past medical history. Here, just tell us patient is hypertensive, diabetic, sickle cell disease is very important here. But you don't have to start saying the patient has epilepsy. You know, What does epilepsy have to do with a 38-year-old obese patient with right upper quadrant abdominal pain? It's a waste of time. So you talk about whether she's been on any treatment, and if you talk about drugs and allergies. If you go through those things I talked about, full marks. Then you go on and examine the patient. Like I said, it's a full examination. You don't skip some parts of the exam because it's only the abdomen we're particular about. You must do a general examination. But when you are doing a general examination, just like I've said, you will state it there. You are going to do a general examination looking for pallor, jaundice, dehydration. Those are the key things that you need for this patient. You don't have to say you want to see whether the patient is cyanosis. Cyanosis from what? So people will start talking about the digital clubbing. Digital clubbing in these patients. So you are wasting your time. Tell us what is related to the question they've asked you. So if you examine the and note that if once you say you check for those three things that are related to the patient, you get your full marks. You get your full marks because there's 1 mark for that. It's not like there's 10 marks. So if you write 10 things, you get no, just 1 mark. If you fully examine the abdomen, including a rectal examination, you get your full marks. Then for the other systems, all you need to let us know is that you are going to examine every other system. You will list the systems. Don't just say I will examine other systems. You list the systems. If there's anything that you think may be related to this diagnosis for that patient, you will include it in that system. Right? And you get your full marks. Nobody's removing your marks. Clinical diagnosis is next. The diagnosis here is acute cholecystitis. The diagnosis is not cholelithiasis. The diagnosis is not choledocholithiasis. It is clear. If you know the diagnosis, you know the diagnosis. And once you get it right, you get your full marks. And the diagnosis actually carries a lot of marks. It actually carries 3 marks out of 30. So if you say cholecystitis or cholelithiasis complicated by cholecystitis, you still get your marks right. But you cannot just say cholelithiasis. That's wrong. If you list differential diagnosis, you still get your 3 marks. If acute cholecystitis is your first diagnosis. So people are writing cholangitis, ascending cholangitis. Did I teach you ascending cholangitis? You then go on to the investigations. Here, there are key investigations, about 5 investigations that any medical student or any new doctor, young doctor is expected to know. You don't have to write, some people are writing 2 more markers in a patient with cholecystitis. Some people are writing percutaneous transhepatic cholangiography for cholecystitis. It means you just read and you just felt, let me read plenty things, stuff, and you are just writing it. You don't pass exams like that. You must be able to treat the patient. So if you say, I'll do a full blood count which may show features of leukocytosis with neutrophilia. Finish. You get your 1 mark for investigation there. The next investigation, I want to do an electrolyte urea and creatinine. Because this patient has been vomiting. Patient may have hypokalemia. Finish. It's not that for a full blood count, you now be saying the patient has, you want to see if the patient has thrombocytopenia, whether the patient has eosinophilia. You are simply wasting your time because that has nothing to do with this particular diagnosis. At least we've not given you anything like that in the presentation. You talk about, you do a urinalysis, you do a liver function test, and you do an abdominal ultrasound scan. And in the abdominal ultrasound scan, we are not even asking for postgraduate level stuff. Just let us know that there will be features of stone in the gallbladder. And you get your full marks, your full 5 marks for the investigations. Next is the treatment. Now, before I go to the treatment, there are other investigations, CT scan. You don't need MRI here. You don't need ARCP. You don't need MRCP. The other investigations that you may need here are other investigations relating to the fact that the patient may need surgery or the patient is obese. So if you want to do a lipid profile, you want to do a chest X-ray, ECG. But for as many people as writing tumor markers or all those funny things, you won't get any marks. Treatment. What are the essential aspects of treatment? You must hydrate the patient. That is the resuscitation of this patient. It is not to say, is your ear, can you hear me? No, it's not, it has nothing to do with airway. It has nothing to do with breathing. It is hydration. Hydration, analgesia, antibiotics, deep vein thrombosis prophylaxis, and you counsel the patients for elective cholecystectomy. At the level of a medical student, I want you to be saying that you are going to manage this patient with antibiotics and you do an elective cholecystectomy in 6 weeks. And I told you in class, and now I know some people were, you see, everything I'm saying, some people actually wrote some aspects of everything I said. So it means that the information must have been passed across. But some people will just probably not come to classes or they will not pay attention. Once you get to the treatment, you get your full marks. Nobody's removing your marks. You can get 30/30. Nobody got 30 in this exam. Right. But some people did very well. I'll start going through some of the scripts now. You should also try and interact a bit. There's nothing bad in you asking some questions, even on this video. Right. Like I said, when you are talking about treatment, you don't start going to the ABCs of resuscitation. If we want you to talk about ABCs of resuscitation, it will be clear. The question will be clear. For example, still in this same exam, you have a 50-year-old man involved in a motorbike accident who developed loss of consciousness, seizures, and bleeding from craniofacial orifices. It is clear in cases of trauma, in cases of unconsciousness, in cases of sudden collapse, that you will go through basic life support or advanced trauma life support, as the case may be. But in this scenario, okay, look at this. They say a 45-year-old worker complains of difficulty reading small print, especially in dim light. Oh, so you are still going to do ABCs of resuscitation for that patient? You don't do that. It means you are not training to be a doctor. You are just training to be a secretary who is just cramming some things and pouring it out. You won't be able to treat the patients in front of you. Take notes. Take notes. You see, they say, talk about urethral stricture in a construction worker. You now start talking about CABs of resuscitation. That's very annoying. Please, let's stop doing those kind of things. Now, I'm going to pick a few answer scripts. Of course, I don't even know who has the answer scripts. We don't know your name. We only know your matric numbers. So I'm not going to be saying the matric number or the names. So it's just for others to learn. So these tips I'm going to give you now are very important. One, okay, no. So before I go to the tips, let's go through. So this person scored 23. A number of people scored 23. So I'll just go through how this person answered their questions and what you should take note of. So this person actually wrote the introduction. You see, the person wrote in the introduction. And what is the introduction they wrote? This case is highly suggestive of a gallbladder disease or biliary disease. 2 marks, complete. Finish. That's just to let us know, yes, I'm in the right mode to answer this question. He goes ahead to the bio data, presenting complaints. This person has a bad handwriting, But the way the person writes is clear. Is the person is leaving spaces, is spacing the everything. So it's easy for the examiner to say, oh, he has talked about vomiting, or he has talked about this. It's not for me to be straining to look, because you see these essays are difficult. You see, I've been marking these essays for 48 hours now. Because I have to read through. Because I can't just give after. It won't be fair if I just say, oh, okay, this writing is bad. Nonsense. No, I still have to read through. So help the examiner by making your work clear and legible. So this person's work is legible, even though his writing is not the best. Okay, so that's what all I can say from this script is that a bad handwriting, but so a bad handwriting can actually be legible. Well, I don't know. Check it out. This person also scored 23, but he started by saying that I will admit the patient, apply BCD of resuscitation. So I just simply cancel the ABC. You are just wasted your time, ABC of resuscitation. So you can see that even though the person wrote that nonsense, he still ended up getting 23. It means that when you write the nonsense, we are still nice enough. We don't cancel the booklet. So we don't fail you because you wrote nonsense. We still look at the good things you wrote, but don't waste your time. And that wrong thing this person has done is, he says, say example for pain, I will ask what time it began. I will ask where he feels the pain. I will ask, is the is it gradual in onset? I will ask, is it sharp or dull? I will ask, is it radiating? I will ask if it's relieving or aggravating. I will ask, is there a fall or trauma? I will ask if there's pain in any other. Everything this person has said now can be said in 2 sentences. For the fever, I will ask what time. I will ask what onset. I will ask if it's worse at any particular time of the day. I will ask for fever if it comes and goes. I find out if the patient had this type of fever in the past. Why? What is all this? Are this part of the characteristics of fever? So this person has spent time just going on and on and on, vomiting everything mixed with blood, blah blah blah. Social history: smokes or takes alcohol or recreational drugs not prescribed. The patient is having multiple sexual partners. I want to find out if there is recent blood transfusion. I will do this. Yes, it's good to say I will. But what I'm saying is that you don't say I will for each say for you are talking about pain. You just say that I will find out about the onset, the duration, the severity, and this of pain. And because you are talking about gallstone disease, you can now say that I expect the pain to be constant and brought on or aggravated by intake of fatty meals. You have got your full marks for pain. So he says he's going to do, now, see another example. He's going to do a general examination. He says, I'm going to check if the patient is pale. I'll check for conjunctival pallor. I'll check for jaundice. I will check for buccal mucosa for if it's dehydrated. I'll check oral hygiene. If I'll check for palmar pallor. I will check for finger clubbing. I will check for pedal edema. I will check for signs of dehydration. I will check for capillary field. Think about it. This person is actually very, I think this is the fastest writer in this class, because this candidate has written how many pages? 1, 2, 3, 4, 5, 6, 7, 8, 9, almost 10 pages. This candidate has actually passed the exam, getting 23 over 30, but there are many things that were not necessary. Right, so the next script, basically, this candidate has a very beautiful handwriting. So this the examiner's delight. That's all you need to get from there. I can't see much here. Now look at this one. This candidate starts by saying, I'll resuscitate the patient using ABCD. And right, goes on to write. Of course, that place is just cancelled. There's no story there. And then goes on into saying he would take a brief history, name and age of patient, that's fine. Talks about pain, yes, he gets his mark. Says any pain on urinating, pain on urinating. From where? As part of the body of the history, pain on urinating. Any change in color of your stool. I've told you this patient did not have jaundice, so why are you talking about the color of the stool? You know? So this candidate has not done well. It says general physical examination. Patient might be pale, jaundiced, with scratch marks all over the body. What we gave you shows that this patient will have scratch marks all over the body. Are you beginning to confabulate for the examiner? Investigations, biliary scintigraphy, liver function tests, clotting. He gets marks for all the liver function tests, urinalysis, ARCP. I think I've made my point. That candidate ends up with 8/20. See this candidate, essay question, just one page. And he says the first 3 lines, he resuscitate with ABCD of resuscitation. So what do you think this candidate will get? That's a beautiful handwriting. So the history, he or she just writes the history. The appropriate history will be taken from my patient. Onset, duration, character, elevating factors, blah, 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 blah. 6 lines. That's all. The examination, I will perform examination on the patient, general, physical, and abdominal examination. It's not supposed to get any mark, but I still gave 1 mark for writing that nonsense. Investigations will be ordered, such as liver function tests, full blood counts, urinalysis. We don't know what they are going to find. CRP, ESR. Then you administer antibiotics. This is very bad. So that's examples of how people answer questions and it's wrong. Another person here, ABCD of result. After I told this class on multiple occasions, I did revision first time, did revision second time, did online revision, told them how to answer essay questions. They are still not answering the essay questions. Of course, I'm not failing them because I'm not marking them bad but it just tells me the level of preparation. If you cannot follow basic instruction in the exam like that, it means you are not prepared for the exam. It means you think the exam is just for you to enter the library and read, and come and just whatever is in your head, you just write. Now, this candidate just comes into the exam hall and says, this is most likely a patient with cholecystitis. And that is everything. That is all. There's no other. I checked maybe the person skipped some pages and wrote it on another page. The whole booklet is empty. And this person will come out and say that they failed the exam and will be wondering why. How can you come into the exam hall and write for this management question and all even if you don't know anything, you cannot afford to write like that. So that's a brief review of the booklets. Now, lastly, there are some points that I noted while marking, which I might not have mentioned. So I will go through all those ones so that you can have a robust understanding. After this video, honestly, I don't expect any of you to have problems answering essay questions. You should have all the information you need. First question. Now, this question that I've talked about was the first essay question. But you know what some people will do? They will answer this question last because they feel, for whatever reason, maybe they are more prepared for other things. I don't know. Yes, we always say you should answer your best question first, but it doesn't mean you should not divide your time appropriately. So meaning that you can't be answering this question last and then you don't have enough time to answer it. You have done yourself great disservice because this is a question where you can easily get your marks, even by not being you don't know too much. Let your points be clear. I've mentioned this. Let your points be clear. Don't let the examiner have to be looking for his glasses because he wants to see your points. Let it be clear. Write legibly. I've talked about time allocation. I'm not going to repeat it. If you have 6 questions in 3 hours, each question is 30 minutes. Outline doesn't give you marks. That you write outline at the beginning doesn't give you marks. Outline only helps you in organizing your points. It's not for you to get, it's not to get extra marks. You don't get extra marks for outline. At the end of the exam, you should ask yourself, do I deserve to pass this exam? If this is marked over 30, you always be sincere with yourself, even before you come to the exam. Resist the urge to just write everything. You just write everything you read. You are just, some people said they will pass NG tube because patient has cholecystitis. Have you seen us manage a patient with cholecystitis with NG tube before? Are you saying every patient that is vomiting should have NG tube? So someone has malaria now, you pass NG tube because the person is vomiting. Always take note of the way we manage patients and don't just write things haphazardly. Somebody in the physical examination was saying that he was going to look out for parotid enlargement. Parotid. What's the business of parotid with a general examination of a patient who has cholecystitis? And he wants to check for xanthelasma. Okay, maybe because the patient is obese. That is just too much unnecessary information. Somebody's diagnosis was chronic cholecystitis with intestinal obstruction. Don't just write anything for the sake of writing. Don't think it's not robots that are marking this thing now. So if I say diagnosis chronic cholecystitis with intestinal obstruction, what does that even mean? I've said it that your writing must be clear. I don't need to repeat it. I've talked about now. Somebody talked about a IDA scan. Yes. Well, have you seen it before? Have you seen us do it before? Have you seen it anywhere before? Have you read about it? In what condition is it currently being used now? So the fact that they mention something to you, maybe in class, as in passing, doesn't mean you will just make sure you write. Any third question they ask you, you make sure you write like that. Polylithiasis is not jaundice. Of course, I don't need to start explaining that to you. Some people say they will call for help. You don't get marks for calling for help for managing this type of patient. We are not, it's not calling for help that is giving you mark. If call for help, that's when you are doing basic life support. That you will give you a mark for calling for help. For calling for help, that you have a patient with cholecystitis, you are not going to get marks for that. If the patient is unstable, we will tell you. You don't have to tell us the patient is unstable, right? Some people were saying that they were going to do x-rays for gallstones because 10% of gallstones are really opaque. Think about it now. So if 10% are really opaque, you will now do x-rays for all of them. You yourself have even given the point why we don't do x-rays for them. Because you cannot be doing x-rays for something that will only pick less than 10% of the condition. Think about what you are writing. This video has been long, but I hope you've benefited maximally. Don't miss any of these videos. They are to your benefit. I wish you all the best in your exams. Cheers.